In the United States, only 35 children are born each year with Pompe disease, a rare muscular disorder. It's even rarer that two young children around the same age in central Missouri suffer from this condition.
So Pompe disease is a genetic condition that's inherited from both parents. The body doesn't make a particular enzyme that is required for the muscles to use the energy that's stored in them, and it causes them to get weak. And without treatment, typically patients who have Pompe will have respiratory failure or cardiac failure and die pretty young.
Parents John and Molly Lindquist were caught off guard when their son was diagnosed.
So in 2013, Missouri added Pompe disease to the newborn screen. And we're fortunate that he is, right now, normal little boy. He can play and he can run, and there's no effects on him whatsoever at this point because he's a later onset.
Ryan and Megan Dudenhofer have a young son with infantile onset Pompe disease.
When he was about 4 months old, we kind of started seeing some things that kind of worried us. So we took him to the doctor, and the doctor said, well, he just has really bad allergies. That's why he kind of has a sickly look. And then for his 6-month appointment, we took him in, and the doctor was concerned about his head control and the fact that he couldn't put weight on his legs anymore. And so he did some blood tests, and Grady's CK levels came back extremely elevated. And then they did an echocardiogram on Grady, and his heart was enlarged. That's the first time we heard the word Pompe disease. We were terrified, and even then the genetic doctor came in and he said, do not Google that word, do not Google it. And of course we did Google it, and it was terrifying.
The Lindquist family chose not to tell their son about Pompe disease.
We go back and forth on this a lot.
And
But
I don't think that it's not so much he doesn't know, he knows, but
Yeah.
we haven't sat him down and said, you have a muscle disease.
yeah, and your life expectancy is shortened. We just don't feel like that's healthy for him. And when he's ready to ask questions and he's ready to, then we'll have to start having those discussions with him.
Currently, only one treatment for Pompe disease exists.
It's hard to say when to start treating the late onset patients. So the main treatment and the only treatment that's approved for use is enzyme replacement therapy.
Myozyme was listed in Forbes' the world's most expensive drugs and mentioned by President Donald Trump in a joint session of Congress.
I'm very fortunate to have health insurance, for sure. We get a weekly infusion with Grady.
We got our last bill from our home health pharmacy, and it was $35,000. Once I got better at explaining it, better at understanding the condition, then I was more open to, I'm going to share this, and I want other people to know about our experience, and I want to be able to help other people. But we had doctors telling us that Grady was never going to walk. We had doctors telling us Grady was never going to talk. We're not going to let that define him.
International Pompe Disease Day will be April 15th. Reporting for Nichols Student News, I'm Daniel Hayden with videographer Caitlin Mulcahy.